We will actually be going into our next talk now. It is medical considerations for commercial low Earth orbit. We have Dr. Brian Musselman talking about human systems integration, Dr. John Allen as well, Saralyn Mark, Dr. Saralyn Mark from talking about a medical journey through space, and then I will be talking about nausea and vomiting in terms of space motion sickness. So in terms of commercial low Earth orbit, we're talking about the future where not physiologically pristine humans may be going into space, either as space tourists or as part of their jobs, part of scientific research. As more and more people go into space, they will have more and more medical issues. So we'll be talking about how to consider those. So our first speaker, Brian Musselman, is a retired colonel from the US Air Force, also is a PhD and a fellow of ASMA, ASHFA, and the Royal Aeronautical Society. He has experience as an aerospace professional, as an educator, scientist, researcher, analyst, accident investigator, and meta leader. Brian is a board certified aerospace physiologist specializing in pressure suit operations and training, high altitude physiology education, and hypobaric chamber training. Brian has specialty training in and has performed on-site investigation for 5 major aviation accidents. He has consulted on aerospace, medical, human factors, and engineering aspects of over 100 accidents. He was the squadron commander of the only physiological support squadron in the US Air Force and served as a US Air Force Medical Group and Vice Wing Commander. He worked at NASA Johnson Space Center as a human factors technical advisor on the development of the habituation and logistics outpost for Gateway, and he is currently the director of human systems integration for Star Harbor. Brian has a bachelor's degree in biology from the United States Air Force Academy, a master's degree in strategic studies from Air University, certificate of advanced graduate studies in industrial organizational psychology from North Central University, and a master's degree in aviation safety systems, a PhD in aviation safety and human factors from Embry-Riddle Aeronautical University. He is an university adjunct faculty, certified advanced rescue scuba diver, FAA private pilot and advanced ground instructor, and former president of the Aerospace Human Factors Association. Brian is a retired US Air Force colonel with 27 years of service. And he will be speaking today about human systems integrations for space. Thanks so much, Brian.
Thanks, I appreciate the intro there. I let you listen about yourself and you're like, did I really do all those things? Great to be here today. Great to talk to you all. Wish I was actually in Australia, but I'm coming to you from Albuquerque, New Mexico, and going to talk a little bit about human systems integration for space. Most of this is based on NASA documentation. And the motivation for this really came several months ago when I was working with a systems engineer on some stuff, a systems engineer that works on space modules and payloads and whatnot. And we had mentioned that we were going to look at HSI requirements. And the systems engineer said, what is that? Is that human software interaction? And I said, no, it's human systems integration, and it's something that's very prevalent in spacecraft design. So I thought, whenever there's an opportunity to educate folks on human systems integration and what it does for space system development, would be a good opportunity to do so. Let's see, my slides will not advance. There we go. As Anna mentioned, I do work for Star Harbor, as does John and Saralyn on the call today. We're a private space company, and we're building a campus in Lone Tree, Colorado, just south of Denver, about 20 miles south of Denver, Colorado, aiming to be the first public space training and research and development campus in the world. So look forward to future efforts with Space Harbor. As human systems integration goes, it's fairly new. If you think about it, in the span of human existence, the Department of Defense didn't really mandate it till 2003. They mandated a total systems approach that must apply HSI. I was involved with some HSI efforts prior to 2003 in the Department of Defense, but didn't really become mandatory until that time frame. And then a couple years after that, NASA added to the human rating requirements for space systems that they focus on processes of achieving human rating and the human rating certification path. As part of that development, they were looking at human-centered design. And then in 2010, NASA published the Human Integration Design Handbook, and that really kind of laid out human-centered design, and with the goal that human-centered design is really the outcome achieved through the proper efforts and implementation of HSI. And then 2013, NASA published the systems engineering process and requirements, or updated, I guess. And this was actually the first time that there was a formal definition of HSI in a NASA documentation. So you think about that, 10 years ago, really is fairly new from a definition standpoint. And it's HSI is applied obviously to further development, and not necessarily required for existing development, like the ISS was not necessarily developed under the HSI constructs. And then in 2014, they published human integration design processes, which really built on human-centered design concepts. And then NASA Standard 3001 is essentially the parent document for all human systems integration requirements. That was updated in 2015 and included essentially requirements for human-centered design. Published 2015, the HSI Practitioner's Guide, just building more documentation towards essentially communicating what HSI is and how to do it. And then the two kind of overarching documents came along really recently. 7123.1, the version D, which is Systems Engineering Processes and Requirements. Obviously, it's been around for a while. The C version also required technical teams to ensure HSI activities, products, and planning were executed within human systems integration. However, the new version that was published in 23, just a couple months ago in July, spelled out this aspect here, that the HSI is essentially co-owned by the Engineering Technical Authority, the Safety and Mission Assurance Technical Authority, and the Health and Medical Technical Authority, which I'll come back to later on in the presentation. And then in 2001, this Human Systems Integration Handbook, which was an update from a previous version, was published. It's a very good document. It's very thorough, and it lays out quite well what the process for human systems integration execution is within human space design. It's a good document, and most of the information in this presentation comes from that. And I'll have a little discussion on that later on in the presentation. So within that document, it talks about an HSI lead. That HSI lead is assigned by engineering in concert with the program manager, and then the HSI lead reports to the program manager, systems engineering, and other stakeholders, and then they facilitate the interaction of the HSI domains, which we'll talk about in a minute. So this is the formal definition of HSI. A lot of words. Interestingly, this word "required" here was added in the version D of the systems engineering processes, which was published in July of this year. So trying to put a little bit more mandatory flavor on doing HSI efforts within space system design. And then talks about, there's the human, software, hardware are all components. They all need to be considered, and we need to build them together. Essentially, we need to not just focus on software and hardware, but the human actually needs to be a part of that equation as well. And then there's 6 domains underlined there that kind of spells out the domains of HSI. I like this quote taken from a kind of an older version of a supplement to systems engineering, but kind of focuses on, designing the system for the human, and not just designing the system and then expecting the human to compensate for the design. These are the 6 domains of HSI. You can read that on your own. Essentially, human factors engineering focuses on human-centered design aspects. They do focus on task analysis, human error analysis, human in the loop assessments, but essentially everything that has to do with human-centered design concepts, if you will. Operations kind of focuses on the control room, the schedule, procedures, mission operations, the things that are being done on a daily basis from an operational standpoint on a station. Maintainability and supportability is about maintenance and logistics, maintenance procedures, tracking of components within a space station, spares, things along those lines. Habitability and environment essentially has to do with crew life support systems, environmental control, crew systems, things along those lines. And then safety. Safety has a pretty robust defined process within NASA design. They're part of HSI as well. And then training, formal training, instructional design, developing training, and executing training for the human. Now, NASA in that document I showed earlier kind of spells out, HSI is at the center here, and there's in theory interactions between the 6 domains and interactions between the HSI lead and those 6 domains. And then they kind of lay out some of those examples here. Human factors engineering does task analysis and coordinates that with folks that do habitability and environment. Safety does probability risk assessments, and those should be coordinated with human factors engineering folks, and maintenance task analyses should be coordinated with the task analysis that the humans are doing, and so on and so forth. So lots of things that a lot of people are doing, and in theory they would all be coordinating with each other to make sure that the system is designed for the human. The Human Systems Integration Handbook does kind of lay out 4 key concepts of HSI. The first one being integration and collaboration amongst the domains. Like I showed in the previous picture, those 6 domains should work together. Includes all personnel. And so when it talks about all personnel, it's talking about anybody that works essentially with anything. It could be users, customers, designers, ground control, payload developers, payload designers, support personnel, logistics, everything under the sun from a personal aspect should be considered within the HSI construct. This system is comprised of hardware, software, and human, which we talked about earlier. And then it must be considered and established in program and project planning early and applied iteratively. And this key concept here is kind of what I'm going to talk about for the rest of the presentation here. And then I have some discussion questions at the end to kind of spark some thought. This diagram is taken from that Human Systems Integration Handbook as well. It's got the HSI lead at the center, and then you see program management. So the HSI obviously reports to the program manager for executing the design process, but then the shared responsibility between the engineering technical authority, the health and medical technical authority, and the safety and mission assurance technical authority. And that technical authority process is an important part of NASA's governance that employs checks and balances among key organizations to ensure that decisions have the benefit of different points of view and are not made in isolation. And so the technical authority oversight, if you will, of the HSI lead in this construct is separate and distinct from the HSI lead's responsibility to the program management requirements within what they're trying to accomplish for the design. All right, so there's another document here from NASA. I'm going to put all this together on the last slide of the presentation to kind of try to make it all make sense. So this is the human rating requirements for space systems. Mentioned this document earlier. This was kind of the first one that laid out human-centered design requirements. And in here it says the program manager shall comply with HSI standards that are laid out in NASA Standard 3001. And then this one hidden behind here is actually the FAA human-centered design document. But this kind of lays out these 3 documents are essentially the foundation for HSI requirements, and then they can be tailored and developed further from there. And it also says that there'll be an HSI team. Essentially, the program manager through the HSI lead will establish an HSI team. And then another document. So this one here, 7120.5, essentially says that they'll develop an HSI plan. And the HSI plan kind of lays out the how of HSI process within the design process. So it talks about the strategy, how they're going to do it, what the 6 domains are going to do, and then essentially how they're going to implement HSI within the program. All right, so putting it all together, as I muddled through the documents, trying to make sense of how to execute HSI within space and kind of communicate that to folks, I put this document together. Essentially, you have the HSI lead in the center, and this HSI lead is supposed to coordinate with systems engineering and integration. Essentially has responsibility to the program manager for program execution, as specified in I think 8705. The technical teams are supposed to coordinate HSI efforts through the HSI lead. The HSI lead is supposed to coordinate with the chief engineer, and then you have the technical authorities: health and medical technical authority, safety and engineering technical authority. And then the HSI lead can tailor and scale the HSI efforts based on the size of the program and the type of program. So if it's a small program, maybe they'll have a smaller HSI team, maybe some different aspects of the HSI plan, but there is that responsibility through the program manager for tailoring and scaling. And then you have the HSI plan and the HSI team. And then this document here kind of lays out that fourth aspect of HSI, or that fourth concept of HSI, which is it applies through the entire life cycle, and that HSI team and the HSI planner is what executing essentially the different parts of the HSI throughout the life cycle. So this is a blown up version. You got different aspects of design within the different pages here, but HSI is going to be rolled up into the concept of operations to ensure that the human element is factored into how we're going to do business. HSI is responsible for human error analysis, essentially in coordination with safety, that does reliability and risk assessment analysis. Early in the process, HSI is going to do HSI requirements development to ensure that HSI considerations are essentially laid, at a minimum, laid out as requirements that will then be defined in the HSI plan, and how other folks are going to apply and meet those requirements. I'm almost done, Anna. And then early in the cycle, they're going to do function allocation, which essentially says what things are going to be allocated to the human, what's going to be allocated to software, hardware. And then, once we allocate to the human, that's where HSI will focus their efforts on task analysis, and then they're going to verify and validate procedures development, along line training, test and evaluation, so on and so forth. So HSI is involved in the entire cycle from beginning to end as far as design goes. So that's the end of that topic. I think I went a little bit over on time, so maybe not as much time for discussion, but 2 thoughts that I have on essentially how I laid out things here are: who is the HSI lead? Now, the Human Systems Integration Handbook discusses this a little bit. I have my opinions on it, and I've seen it done well and not done well. And then I just came across this paper here that talked about collaboration overload, and that's really what, from my perspective, that I see from this concept here with the HSI lead. They're essentially responsible to everybody for everything, and in that they're essentially overloaded on collaboration aspects. And this paper lays out these three different aspects of collaboration overload as problems when we have super matrix teams like you see here with this HSI lead layout responsibilities, if you will. So, and that concludes it. Hopefully you learned a little bit there, and willing to talk and discuss things.
Great. Thank you so much for that outstanding talk. I think we're going to save the questions for the end. I know there's some in the chat if you're able to answer that, Brian. Yeah, really outstanding. And such an important topic. I know many of you are familiar with human factors and human systems integration, but for those of you who aren't, anytime you've ever been frustrated with technology, it's oftentimes the reason is that there was insufficient human systems integration or insufficient human factors work done. So our next speaker is John Allen, How to Build a Spaceship Quietly. He serves as the director for medical standards at Star Harbor in Lone Tree, Colorado. Prior to this, he worked as the program executive for crew health and safety and for the NASA Human Research Program at the NASA headquarters, overseeing space medicine and research activities for human space exploration. Dr. Allen received a BA in speech communication from the University of Maryland, followed by a master's in audiology and speech pathology from the Catholic University of America, and a PhD in audiology and bioacoustics from the Baylor College of Medicine. He served in the U.S. Air Force for 26 years, retiring in 2006 at the rank of colonel. During his USAF career, U.S. Air Force career, he held clinical and research positions, instructor at the Air Force School of Aerospace Medicine, consultant to the U.S. Air Force Surgeon General in audiology and speech pathology, commander of the U.S. Air Force Medical Elements, and was detailed to NASA headquarters. He has given presentations at the national and international conferences on topics ranging from hearing and communication challenges and mitigation, spatial disorientation, and space human factors. Dr. Allen is the co-author of a book chapter on space acoustics and audition. And today he's going to talk about audiology on the spaceship. It sounds like. Very excited to hear this.
Thanks so much. And like Brian, I'm really pleased to be here. And like Brian, wish I were in Australia. But and I'm so glad that he went first, because what you'll wind up hearing through this is there'll be a number of things in my presentation that directly dovetail back to what Brian was talking about. But I'm going to be focusing a lot more specifically on one entity, and that's the entity that I know the most about, and that's hearing and acoustics. I say this about how to build a spaceship. Brian has given you a really good outline of how to do that with the entire HSI process when we're talking about humans in some kind of a spacecraft. But I'm going to come out of it slightly differently. I don't have all the documentation to go with that, and I will try to make up some time, but when I talk, no guarantees. What I said about building your own spaceship, I looked at these kinds of things as I thought through them, and you'll see some terms that will pop up here that Brian had mentioned. But obviously, my bent is whenever you're doing this kind of work, and whenever you're doing any kind of work that involves a human in a system, then you got to start with the human, and we'll talk more about that. And from there, we look at building standards before the hardware, so don't have the hardware start on under construction before the standards exist. From there flow some acoustic flow requirements. I'm going to speak more specifically to acoustical requirements. And Brian had mentioned habitability. Habitability is a big issue as far as building any kind of a spacecraft. And from an audiologist perspective, we look at things that are concerning auditory and non-auditory effects from noise, communication interference, and then also detection of caution and warning signals. But what does it mean to start with a human? First off, what are humans? Well, what humans are we talking about? Well, we're talking about humans of all sorts, particularly as we're, from this panel's perspective, looking at commercial spaceflight. So that is a much broader age range, gender, all genders, all nationalities, et cetera, are being considered when we start looking at commercial spaceflight. So we're trying to be as inclusive. That's the entire commercial sector for spaceflight, as inclusive as possible. But those do present many challenges. So how many humans are we talking about going into commercial spaceflight? Well, how many would be on a spaceship to begin with? Well, that could be anywhere from 2 to 4, or maybe like on Space Station, they've had 12. But, I threw in the 11,000 number, not that there's going to be 11,000 people on a spaceship. Well, maybe in the far distant future, that could happen. But we're looking more at from, again, the Star Harbor perspective of how many individuals may be coming through our doors for training in one capacity or another. Those may be individuals who are actually going to fly. But there could be individuals who are space enthusiasts. Those are individuals who are supporting spaceflight. So we look in the future that it's going to be a burgeoning, really largely, fastly growing market. And so that, a lot of humans, actually. But as far as the spaceship itself, we have to look at also the anthropometry of those individuals. They're going to be tall people, short people, thin, less thin, looking at the entire dynamic in terms of sizes and shapes of individuals. And then abilities, people that have sensory system challenges, that may have difficulty with strength or agility or et cetera, or at various levels of any of those. Consequently, those have to be factored in when you start looking at building any kind of space vehicle. building standards is really where the baseline comes in, and this is really exciting stuff. If any of you have ever been involved in it, you'll know it's paperwork. There's a lot of work to be done, but there's a they set a standard framework upon which requirements are built, and so they are incredibly critical. And actually, we've been having at Star Harbor, and I will say, a fun time working on standards and requirements for commercial spaceflight. So what's the great part about requirements? Well, maybe it's that you get to drive engineers crazy, or that you get to drive budget people crazy, because the engineers have to work with what you are setting up in terms of the standards and requirements. The budget folks have to deal with that it may cost more money to do things particular ways as we involve human beings. But actually, everyone, the standards and requirements are there to hold everyone accountable, whether it's the people who are the engineers or the budget people or the medical folks who are working to work with the customers and individuals who will be going into space. I'm going to speak more specifically to the acoustical requirements. Brian was very good about laying out a lot of the requirements that NASA has set out, and I'm not going to go through those again. And I really want to focus on the magnificent ear and what's the basis for where those requirements come. The fundamental aspect of it is it's back to within the human, the auditory system itself. This shows, as you see on the dotted line toward the bottom, the threshold of audibility. So it's showing here, that's where you can just perceive a sound. And you can see as you go from low frequency to very high frequency, the amount of energy that is required varies from frequency to frequency. Consequently, you can't just draw a flat line and say that's your threshold of audibility based on decibels. So this really gives you a good idea of the energy differences as we go across. Most hearing evaluations are focusing on a range of about 250 hertz up to about 6,000 hertz. That's a flatter area, but still there is some variation in that. When we talk about noise and measurement of sound, we look at decibels, and decibels are weighted differently. I won't go into all of this, but the A-weighted scale is the one that we use most of the time when we're talking about things related to humans, because as you see from the curving, it looks somewhat similar to the curvature that we see here, and most closely represents how humans can hear. Auditory effects of noise, the ones that I dealt with all the time in the Air Force, noise-induced hearing losses certainly come about as a result of exposure to loud sounds. We get concerned about that in spaceflight as well. And really the greatest impact is going to be in the higher frequencies, at least initially, but over time it will drag all the others down with it. And that's usually due to some damage in the cochlea from consistent noise. And that noise has driven other kinds of requirements and regulations. Those you can see, ones that are established by OSHA. We have ones that are established by NIOSH. World Health Organization has them as well, so that we set levels for how much noise an individual can be exposed to at what particular intensity level before we start to be concerned about the impacts of noise on the hearing system. And if it does get above those levels, then what do we do to mitigate that? And we'll talk about that just in a little bit, but not to any great extent. In spaceflight, the sound levels can range from 45 to about 80 decibels. That's not including the launch. And I'll discuss the launch here in just a moment. Then where does that noise come from? Ventilation fans, pumps, communication systems, payloads, et cetera. And so NASA has set flight rules for maximum noise exposure for a 24-hour period. And so that if anything exceeds 85 decibels at any particular time, they are required to use hearing protection. The place where that might come into play the most would be, say, with exercise equipment. The treadmill tends to be fairly noisy. Actually, one of the noisiest things on there is the waste management system, the toilet, which on the space station is not far from the exercise equipment. So there are times when hearing protection is required. But by the same token, you can see that range of 45 to 80 dB. 45 is pretty low. And I'll talk about that here in just a second too. As we look at those exposures, the 8 hours or more for a 24-hour period, we're talking about continuous noise sources. That would be like fans. That would be like pump going on. Intermittent noise sources, though, same things that would be more of a percussive nature. There's a different requirement for those in terms of how much they can be exposed to. And we set noise criterion levels that allow us to then to identify how much noise an individual can be exposed to while they're in a space environment. on a daily basis. This looks at the launch noise, and you can see that it starts out here at around 70 decibels, but quickly gets up to almost 120 decibels, bounces up and down, and then back down. But this is really 2-minute window. So that's not an extensive period of time. And then by the time you get out to 10 minutes, you're back down to those periods of those levels you were seeing before launch. So while the launch aspect of it is extremely loud, it is not loud for an extended period of time. So the amount that we're concerned about as far as noise exposure from a hearing loss is not huge. I haven't seen data that has come back from the commercial systems, SpaceX and the others, so I'm not sure what those noise levels are like. But what NASA instituted to try to mitigate that, it was routine hearing testing. They get annual audiograms on the ground. They would get hearing tests before they fly. They would get hearing tests after they fly, and they would get hearing tests in flight. This comes from the book that Anna mentioned at the beginning. That we published. We're working to hopefully update. The on-orbit hearing assessment is still there, but the equipment that we're using now is different and is able to give us a lot more information about the hearing status of the astronauts. What will be used in commercial spaceflight is going to be determined by the commercial spaceflight providers. So all of that gets into that thing that Brian was talking about in terms of habitability. Habitability is one of those where you just try to make it habitable. This photograph actually comes from Skylab, so it's way back. But even with Skylab, there were a lot of concerns about how can you make this environment comfortable and workable for the individuals who are participating. So do you engineer it or do you design it? I mean, that's a conversation to have. Personally, I think you design it. You design it because you're going to bring in the engineers. You're going to bring in the folks like Brian. You're going to bring in the medical personnel who can then tell you whether things are not appropriate or not. And then you can work with physical layouts of the system to try to identify and make sure that through a mock-up, that the system works best for you. And that works, and I'm specifically talking here to communication situation, because you want to make sure that those things that are generating the most noise either are mitigated as far as the noise exposure or are put far enough away so that average conversation is not being affected by it. It's not impacting their hearing, but also that they're able to hear all other kinds of communications, whether that's headphones, communications with the ground, etc. So trying to make things as comfortable. And one of those other portions is when you get into sleep, and I'll just mention that briefly here in a minute. Alarm audibility is a really important one. Brian could talk to you probably extensively about all of that. We have a good deal of information about alarms and alarm audibility. I won't go into detail, but there are different levels and in terms of urgency, and consequently different kinds of tonal information is used. Future clinical concerns that we have in terms of looking forward for low Earth orbit, even long duration spaceflight from a commercial perspective, are things that NASA has been looking at. Impact of long duration missions, the impact of health effects of noise on crew and sleep. And I can say right now that we have found from my experience with NASA that despite the noise that is there, it has been mitigated tremendously in the space station over the last 20 years, now 25. And we have not seen significant hearing loss as a result of the noise exposure that individuals are exposed to on space station. Radiation and central nervous system health concerns exist. And the research community looks at those too, to whether there's any impacts from an auditory perspective. And that was brought up during a question in the earlier run. Further commercial concerns, those same ones that NASA has, but you might add to that the impact of comorbidities. This was the previous panel. You're bringing up individuals that have all sorts of different medical things that I talked about in different ages. So all of the impacts there, and that runs into the impact of fitness, the expectation of an activity. And what is the importance then of commercial missions? We talk about it at Star Harbor, and all of the commercial sector does as well, opening the aperture of participants, getting more individuals being able to go into space, greatly expanding the database of medical of those things ahead of time, or determine who is best suited for what kinds of missions and how we might be able to help them be successful in those. Increasing the amount and type of research conducted. So as I was just speaking to, advancing technology and development, not just for space exploration, but also for terrestrial applications as well. And also driving down the cost of and driving up the accessibility so that more and more people can participate. It's been a pleasure, and I'm going to wind up here. The reference that I mentioned is down at the bottom, as is the link to the book. Please help yourself to that. And thank you again for your time. And I apologize that I've run so long. Thank you.
Fantastic talk. I really learned a lot. Audiology is just so cool. Thank you so much. So I'm just going to actually kind of briefly go through space motion sickness, because it's a little bit of the outlier here is my talk. And that's, I mean, all of you are talking about such amazing systems approaches and just all of the really cool things that you can do. And on the same theme of medicine for commercial spaceflight, I wanted to delve down a little bit into a very specific, kind of more granular topic, just to give an example of one of the many important medical issues that the other panelists brought up. So space motion sickness, disclosures, none relevant to this talk, but full disclosure, book and article royalties. So I wanted to talk a bit about the physiology of space motion sickness, and then non-pharmacologic and pharmacologic possible interventions, with the caveat that none of these have been studied, and these are all avenues for possible research, some which have more potential than others. As I mentioned, we had physiologically pristine humans going to space in the past. Now we're going to have, with commercial space flight, a much broader range of medical issues in potential space tourists and astronauts. I'm an anesthesiologist. Why would an anesthesiologist be talking about this? Well, dealing with nausea and vomiting in the perioperative period is one of the key elements of our specialty. So plain old motion sickness here on Earth is the difference between the inputs of your visual, proprioceptive, and vestibular systems, difference between what you're expecting and the inputs that these systems are actually receiving. As many of you know, symptoms, nausea, vomiting, not very hungry, can get anything from that, but also central nervous system issues, headache or drowsiness, cold sweats, pallor. These could certainly be an issue on a long-term space flight. If someone's not eating well, not drinking well, they can very quickly become dehydrated and lead to other medical issues, both on Earth, but even more of an issue with the limited medical resources on a space flight. Can, interestingly enough, get something called SOFITE syndrome, where you have drowsiness, fatigue, irritability, acting strange, and it can persist for days after an episode of motion sickness. And this could be a major problem for a required crew member. Why does space motion sickness happen? Well, could be due to the fluid shift theory. So you lose those hydrostatic pressure gradients in the body fluids shift towards the head becomes puffy, the intracranial pressure increases, pressure in the cerebral spinal fluid and inner ear increase, and the vestibular receptors can't respond normally. Also, another possible option is the sensory conflict theory, loss of the normal signals to the otolith, and this occurs when there's a tilt against gravity, and the eyes and the vestibular system sensory inputs are in conflict. So traditional things that we use to treat motion sickness have all been studied on the regular conditions of Earth motion sickness. And now you have these two added variables, the sensory conflict theory and the fluid shift theory. So perhaps the current treatments will work, perhaps they won't. One strategy to look at, though, even with the lack of research, is that neurogenic misery. So it could be anything, migraines, motion sickness, chronic pain, even acute pain. All of these neurogenic terrible things that happen to us, which I also like to call my brain hates me today, all of them benefit from a multimodal approach. So the more things that you can throw at it, the better that we are able to treat all of these types of neurogenic misery. Something called multimodal therapy seems to be really effective. So perhaps Multimodal therapy will also work. Using multiple different treatments will also work for space motion sickness. The non-pharmacologic treatments are preferred. Here I have ginger and also alcohol, but it's not the alcohol itself that will help. It's avoiding the alcohol that helps with avoiding motion sickness. Ginger, also non-pharmacologic, seems to work perhaps as a serotonin antagonist, 5-HT3 mechanism, very helpful for typical motion sickness. There's also an acupressure point, and they have little acupressure bands that are sold. And this is actually between the two tendons is this P6 acupressure point, and that can be effective as well. Unfortunately, won't work in space, but for normal gravity motion sickness glasses, try to at least make the motion and what you're seeing a little bit more in line, a little bit more congruent, because the fluid moves as you move. Obviously won't work in microgravity because you don't have gravity to keep the fluid at the bottom of the glasses. Something else that's really interesting, our friend Jamie Harvey actually did this in the military for a while. It was her role. Thought it was really fascinating. She would literally just spin people all morning, and then they would go flying all afternoon, and they were able to get rid of the motion sickness. Some of the literature says that the success rate was up to 85%. And she told me about this, and I said, sign me up. And she said, you'll be miserable. And I said, I don't care. If I could get rid of my motion sickness, I would spend a week with you with you spinning me. And she said, well, the second, when you stop the motion, when someone, for example, the fighter pilots stop flying, they no longer, the effect is gone. So I thought she could spin me, every morning for a week and my motion sickness would be gone for life, but that was not true. So when the motion stops, or you stop the motion on a regular basis, then the effect is gone, perhaps even within a week, but could be another mechanism to do immediately before a mission. So pharmacologic, again, none of these have been researched yet for space motion sickness, so areas for future research. I need definitely medical professional supervision. There's variability in effectiveness and variability in side effects, and trying in a safe setting on the ground first, really important. And as I mentioned, for neurogenic misery in general, doing more things is helpful. Certainly more non-pharmacologic interventions could be helpful. But when you get into the pharmacologic interventions, caution really needs to be taken. Combining drugs can lead to unexpected effects, and they can be quite severe or even life-threatening. So care must be taken with any pharmacologic intervention. One really interesting one is if someone's already a migraine sufferer, prophylactic migraine medication, and making sure that they don't get a migraine ahead of time may actually decrease motion sickness. Kind of makes sense, but I don't think I would have thought of that. This is from the literature. H2 receptor blockers. This is this is not from a research paper. It's more just something that people do. I don't think it's been studied yet, but does have the advantage. This is your famotidine, that it's not sedating. Again, with the doctor's supervision, there can be common and uncommon side effects. So common headache, dizziness, constipation, and uncommon severe problems. First generation histamine receptor antagonists. There are some that also have anticholinergic effects. So diphenhydramine, promethazine. There's others that only hit that histamine receptor, or mainly hit the histamine receptor, meclizine. These are a big problem for a required crew member. They're all sedating. I don't think that you can fly with these as the pilot in command, to my knowledge. So these are probably not going to be, they may work for space tourists, but anyone with a required role, they would not be very helpful. Commonly dizziness, headache, dry mouth, also rare severe side effects So of course, with the doctors, only under a doctor's supervision. Scopolamine is popular. We actually use this in the perioperative environments, but I do find it can cause severe dizziness and lightheadedness. So I find it's not a great option for people who are middle-aged or older in my practice in the perioperative environments. It really can cause very severe dizziness or lightheadedness. So I don't know that this is going to be a great option for space tourism. Things I'd avoid: droperidol was historically used before we had better agents for nausea and vomiting, but causes really severe dysphoria. Definitely not something that you want if you're stuck on a spaceship. Dexedrine, I know this is used in the military, in young people, but that seems to be a very tightly controlled environments with healthy young people. Even there, it's certainly a risk. Addiction potential, serious potential for cardiac problems, especially as someone gets older. Although I have read papers where it was pretty commonly used in the military, but those are probably not going to be great options for commercial spaceflight. Great, and I will leave time for questions. I know we have a lot of really wonderful questions from the audience. Did any of the speakers want to start by answering one of the chat questions in more detail?
Anna, thank you for that fantastic presentation. And space motion sickness, oh my goodness, is so important when you feel ill, especially the first few days. And as we all have in our lives, you just don't want to do anything. And being able to control that is so important. And knowing who may be at higher risk, we would often think that women who had pregnancy-related emesis would be at higher risk, and it hasn't really been the case. Or if you've been, car sick, that isn't the case. So really understanding that, especially for the commercial space sector. So thank you so much for bringing that up tonight.
Thanks. Yes. Thank you for your outstanding talk as well. And I know you had a lot of questions in the chat. So do you want to start by addressing some of those?
Yeah, so I tried to answer as many. I think I've answered almost all of them. What I'd like to do, and John has also referenced one in regard to the issue of aesthetics and functionality and how important. I provided my perspective that, of course, safety is most important. And as we move into the commercial space sector and having that hospitality environment, we have to be aware of aesthetics. People have to feel comfortable in their environment. But again, safety and functionality will be the priorities. But there are ways we can make it a nice environment. I've been looking at, there's a new movie that just came out on Netflix last night, and it was about, I don't want to give a giveaway, but about a bunker. And having a world around you that looks somewhat comforting. And I think that plays a very important role with the psychosocial aspect, and then how well you're able to sleep and how well you're able to function. But I'd like to throw this question to my colleagues, because I know you see it through your lens as well.
Yes, Saralyn, I would say that.
Oh, go ahead, Mus.
Yeah, just real quick. So one of the things that HSI brings to the table is human in the loop assessments, and that's essentially putting a human in a mock-up of whatever it is you're designing, say the hygiene bay, and having people walk through that hygiene bay and saying, does this fit you? Can you wash your hair here? Does the placement of your personal items, are they in the right location? What would work better for you as a human? And so some of the aesthetic aspects can come out in that human in the loop assessment to make it a little bit more human. You look at pictures of ISS, and you're like, that it looks like, it doesn't look like a place that's very, very exciting to be in and very inviting. So some of the stuff that the Hill looks at is how to make it a little bit more aesthetic and appealing, if you will.
And it's really intriguing looking back again at Skylab, this being the 50th anniversary of the Skylab mission. When they were first designing that terrestrially, they were thinking about painting the inside of the Skylab yellow, a muted yellow, but a yellow because it was going to be comforting. They thought it was more comfortable, more comforting to the astronauts. You can see NASA did a really good job of going with aluminum. But there's not a really good. Well, I think Brian touches on it really well. when we're dealing with those kinds of things, aesthetics versus, are we doing it engineering wise? It has to be safe. It has to be done properly. But there's no reason why we can't bring into that process the designers, which I think is really great, Sarah, because it goes back to your discussion about it's not STEM, it's STEAM. So we have to have the artists involved in there too, where they learn from one another. So that'd be my take. Adrienne, you had asked the question and you asked about Astro Access. Thank you. I'm glad you're here. Could you explain Astro Access a little bit for us? Put you on the spot.
Yep. Sorry. Yeah, sure. So there was a group called Access, which was based out of Columbus, Ohio, at the University of Columbus. I'm sorry, at the Ohio State University. And I learned about them a few years ago and was able to do a presentation at their first Access conference, which was about making STEM education much more accessible and really STEAM education. And then there's an offshoot of Access that's called Astro Access. So I think they've now done 3 different parabolic flights where they've brought in individuals that apply to participate. They get to go on a zero gravity flight. And then they also do some testing of different, haptics or materials or technologies that they can test out to see how the challenges that someone might face if they're blind or visually impaired, if they're deaf or hard of hearing, if they have other physical disabilities. And the idea is to start and continue that conversation about what is needed to make spaceflight truly more inclusive. And I know at least one person that was involved with Access and Astro Access has been doing some research about the idea of using sign language and training astronauts in sign language. So if they have difficulties in hearing what's going on, this sort of goes to the acoustics question as well, then they could communicate with sign signals or hand signals in some way. I know that astronauts do have some hand signals they use on spacewalks, but they don't use American Sign Language or some other sign language. So that's the whole idea of Astro Access. And I think last year at this conference, there was one person who was about to go on such a flight. So I don't know if they're participating today. Hopefully that answered the question. It's a not-for-profit organization that's getting funding. I don't recall who's providing the funding, but I know that was that idea. I will also mention that ESA, the European Space Agency, has been creating a program to try to include more people. And they were looking at, I don't recall which disabilities they were looking at. I think it was strictly like maybe paralysis or something, to see who could go into space and how you can make the space environment more accessible and inclusive. I think the other aspect of those flights are the understanding, and this has come up in some of the different talk, especially what Dr. Mark was just saying. Everybody changes in many different ways in spaceflight, and that's mostly just Leo that we've had so far. And the idea that someone that goes into space on a long-term mission to the moon or Mars, or strictly being in a spacecraft the whole time and not landing anywhere, there's a good chance at some point as these missions continue, someone is going to become injured in a way that creates a permanent disability, or someone maybe already goes into space with a disability that gets worse. So that's the idea of those flights. Partly it's sort of the social justice inclusivity question, and it's also the pragmatic idea of understanding that space flight needs to have the understanding of potential for disabilities as part of the missions from the beginning.
Absolutely, and actually we've had some contact with Astro Access. Thank you for the question. Sarah, Brian, Anna?
Yeah, so I got a question about the issue of using artificial intelligence. It was virtual reality for whether it be the lunar surface or the Martian surface. And I just want to follow up on it because it really connects nicely to what we just last talked about. First of all, in space, communication can be challenging. And John, I know you can drill down into a lot about that as well, as far as people being able to hear each other. And by the way, as we age, men lose the decibel range of women's voices, so they don't hear women as well. As we've joked, we think that's a survival mechanism, but nonetheless, it's a problem, right, Brian, as we communicate. But then also that cephalic distribution, we get these moon faces. So as I'm looking at all of you right now, I only am able to communicate with you through your facial expressions, which is challenging in this two-dimensional world. And then again, with that puffy face, it can be even harder. So as we just heard, whatever means of communication, whether it be sign language or other modalities, will be extremely important. So going back to that issue of using virtual reality or AI of any sort, it's really, it's a simulator so that people can literally walk in somebody else's boots. The UN actually helped pioneer it, and then we're trying to transpose that into the space program. Because I often say that if you go in a mission, basically in a vehicle that's like the size of a VW bus, and you don't get along with your colleagues, you can't vote them off the island, you can't throw them out the door. You have to figure out how to do this without killing each other. And the element of communication and team building is so important. NASA has put an extraordinary amount of time trying to find that cohesive, perfect team where there is enough diversity so that you don't have that there's redundancy in skill sets, but that there's enough diversity to build team cohesion and effectiveness. So using whatever simulators is very, very important. Put yourself in somebody else's shoes for a day, and you see the world very differently. And I think that sensitivity helps people learn how to interact with others more effectively. Brian, John, your thoughts on that?
Right. Yeah.
No, I don't. I mean, I don't really have anything to add to that.
Nor do I. Thank you. Sorry, you said it too well.
Do we have, I think we have about 5 minutes left. Do we have any other questions from the audience?
Yes, we've got Supriya would like to ask a question.
Thank you, Professor. Yes, Dr. Mark, thank you very much for your presentation. I just had a quick question on the lunar VR environment. I was just wondering if that was an actual environment that's been designed. As you mentioned, it has some cohesive team building aspects as well into the VR. I was just wondering if you could please speak to that or describe that sort of.
Yeah, so it was in relation to a challenge competition that iGiant partnered with Explore Mars, and I highly recommend that you look at a lot of Explore Mars documents. They just hosted a meeting this past week to look at some of the issues that we've talked about tonight, and they're really taking a deep dive into what it's going to take to get to Mars and stay healthy on Mars. And when you think about going to our habitats, which certainly a lot shorter and not necessarily easier to get to, but one within our immediate time frame. Looking with simulators is extremely important. When we trained our Apollo astronauts, we actually took them out to remote locations such as in Utah, Arizona. I think the Outback would be a phenomenal place as well to help them train how to work with the geology of the place, how to work in isolated environments. We use a lot of analog environments for training, such as in Antarctica and in Hawaii and Nemo. But going into environments that look like the environment you might be in is extremely helpful. But today, we have the use of artificial intelligence, which is really an asset. But there are also sex differences here that I just briefly need to mention. I've been in touch with Google about it as well, is that when women use these headsets, they're not really designed, and perhaps John can talk a bit about that, for the ear, for the way people need to have a sense of comfort. There also, it's that eye confusion that is also happening. So women actually have more headaches, more nausea. They can't tolerate it for long periods of time. So when we've done studies looking at how well men and women use VR, often women fail, and it's not because they're not great candidates. It's the technology hasn't been designed to meet their needs. So instead of retrofitting it, we need to understand it and design better technologies so that people can use these simulators and actually perform well. It's very, very important to do that up front. And it just brings me, just as a side note, when we've talked to NASA engineers or any engineers, they often tell us, teach us what these issues are so that we can design the technology right from the start. Because if you don't provide the people who are going into these environments with their resources and tools that work for them, it will be a fail. And it will be a fail because they can't train well, and then they can't perform well when they're in that environment. Any comments from my colleagues?
Yeah, Sarah, and the train from the start was sort of what I was getting at too, or design from the start, because we've learned the hard way. So many different organizations have learned, mostly the government, that it costs way too much to retrofit things later. So having them designed initially and considering that human and that human, not just that male human, that looking at the variety of individuals who might be using whatever particular type of equipment. Back to the headsets. Brian, you may be able to talk to this better than I'm not sure, but early on with when the air that Sarah describes, nausea, disorientation, and it was partly because they were getting a lot of visual input, but they weren't getting other sensory input, certainly no kinesthetic or tactile. So there have been revisions made to those systems. Brian, have you worked with those? I can't remember.
No, I'm not too familiar on that. I do know that there is some motion sickness with VR, and there was, I saw some research maybe about a year ago on essentially trying to compare VR to reality as far as effectiveness for training and for procedures and things along those lines, and we're just not there yet. Like the fact that you can take a hand and stick it through a cabinet when you're trying to load something into a cabinet with VR is not really the reality that we need. So it's a great tool. It's beneficial. We've done some limited HITL work in virtual environments, but it's not the same as a real 3D environment. So
thank you so much to all of the speakers for being on this panel, and thank you so much to Rowena for inviting us. We really appreciate it, and hope you have a wonderful rest of the conference.
Sincere thanks to you, Brian, John, and Sarah, for such a fantastic panel today, and it's been really, really great, and I really appreciate all the hard work that you've all put in, and also for giving up part of your evenings to come along. We sincerely appreciate it. So we'll clap from all.
Thank you to all the folks who had questions. It was great.
Yes, fantastic. Have a wonderful meeting, everyone. Bye-bye.
Cheers.
Thank you very much. Bye for now.